ambulatory on the scene. They've got some neck pain, they don't have any deficits. If somebody has neck pain, I'm putting a collar on. Just because you kind of have to. Could it be that they have, like a whiplash type injury? Sure. And that, is probably going to be harder for them to heal from than a fractured vertebrae, depending on, things. But you're still going to put them on. It's only when they have no pain, no deficits, and all that you don't do it. Okay. So, if you're going to do spinal motion restriction, you have to make sure that they're not going to be moving around. Because again, one part of the body moves, and it causes flexion of that spinal cord, the spinal column. That's not a good thing, right? So we have to make sure that their hips, you can crisscross the chest straps, but we want to make sure they're not too tight because then they can't breathe. It's bad when your patients can't breathe because you made the chest straps too tight, right? And make sure you put the proper size collar on. So, common mistakes that people do: the wrong size collar, not padding behind the head or the torso if need be. You have to put grandma. Even if you put her on the stretcher, sometimes the kyphosis is so bad that her head is not going to easily rest, and you don't want to push her head back. You might have to put a blanket or a pillow or something behind her just to have her in her normal position, okay? Because she's got the humpback thing going, okay? So you want to have them in whatever their normal neutral position is. So you adjust the body before the head. All right. What do we do with our larger patients? Yes. We call for help, all right? Are they going to fit on some of our devices? No. Sometimes we might have to get a bigger stretcher, right? Or a bariatric ambulance. Is that always available? Hell no, right? But we have to be careful with how we position folks because there can be so much tissue that when they are in a supine position, they may fail to breathe because of the weight of the tissue on them, okay? So you have to monitor their respiratory status and just maybe don't lay them supine if you can avoid it, all right? So you gotta be careful. You have to be careful if they just barely fit on the stretcher and you've got to get those side rails up, make sure you're not pinching anything,